Hi everyone, we're going to be taking a look at our Cerner Firstnet charting for emergency department nursing today. So first we're going to go over here and find our Cerner Millennium icon. We'll open that window. Then once we get here and get signed in, your Firstnet icon is the red one here. You'll click on that and it will bring you up to the launch point tracker to this window here. We're just going to kind of go through a quick tour of this. So first of all, up at the top, you have toolbars. Some of these you're not going to use so much because they're intended more for inpatient nursing, but there is a toolbar here with links to other programs. LexiComp, which we use, it's a handy tool for IV medication, especially to make sure that IV meds are compatible. Let's see, our blood administration program, Bridge, is found here. Lippincott. Then this toolbar down here at the bottom, this is the one that we're probably going to use mostly. There's ad hoc charting here, medication administration, medical record requests, patient pharmacy, etc. So these buttons, you actually have to be in the patient's chart to use these, and we will look at that a little bit later. So let's just kind of take a look at how our launch point tracker looks here. So personally, I like to be able to see the empty beds, but we're going to start there. If you want to get rid of these empty rooms on your tracker, empty beds right here, deselect it and that will get rid of all of those for you. If you don't want to see patients in the waiting room, which right now I don't have any patients set up in the waiting room, but because I have this selected, if there was someone out there waiting to be triaged, they would show up down here at the bottom of my board. But if you don't want to see those, deselect that waiting room option. Personally, I like to see the empty beds so that I see what rooms I have available. So once you've assigned yourself to a patient, you can then go up here to the My Patients tab, and this will show only the patients that you have assigned yourself to. You can get rid of all of those extras that you won't be looking at. You can also just click the waiting room tab, and that will show you only the patients out in the waiting room. And then there's the disaster tab. So that's only used in our disaster situations. So let's go back here to all beds. I want to show you how to move a patient into a room. So let me just move this one back out to the waiting room so I can show you. So when the patient comes through front registration and through triage, they will be in a waiting room bed on the launch point tracker. When the triage nurse brings them back and rooms them, they will move them for us. And to do that, you just click on the room over here and put them wherever you want to put them. So we're going to put them back in 29. And I also want to point out while I'm right here, if you didn't notice, when we move a patient out of a room on the tracker board, it will automatically give us a dirty notification in that room. So let's just put that patient back in 29. Now I want to show you how to check in to the Firstnet system, to our launch point. To do that, you go over here to the 3 bars drop-down menu, click check in, and from here you can change your display name. I think you get three digits here. You can change your provider role. We're obviously always going to be nurse or PSA or paramedic. You can make that a default relation as well so that you don't ever have to choose a relation with a patient. it will default to that. You can change your color, and let me show you where that pops up. We're going to change to pink. We want to make sure that we mark this box down here that says available provider. Then I'm going to sign up for this patient here in room 4. Click here in this box where it says RN. Then you can click assign, and it'll put your initials here. So I'm going to show you also, while we're right here on the tracker, how to pre-arrive an ambulance, how to do a quick registration of a patient and put that patient in a room, and then how to combine the chart with the pre-arrival. So ambulance calls and says they're headed out to a shortness of breath. So we're going to go up here with our little person with the plus sign, add a pre-arrival. Right now we're just going to put in the basics. So our local ambulance service is BFD. We're going to put them in. We're going to pick a room. It looks like 7 is open, and they said shortness of breath, and this is coming from home. It is not coming from another emergency department. So just the basics for now. Now you'll see that that pops up this pre-arrival here. So 20-30 minutes down the road, when they call back and want to give you a report on the patient, all you have to do is click where it says BFD there. It'll open this pre-arrival back up. Then you can enter in your information up here. Whatever information you want to put in. Gives you a place up here for your vitals, your EKG, whether they had aspirin, Narcan, code status, blood sugar, lots of options. If there's anything that you want to put in this pre-arrival form that's not an option up here, you can put it in down here in the additional patient information. Then we're going to save that. Now, when the patient comes in, our registration staff are going to register the patient, but I want to show you quickly how to do that. And it's the same button up here. You go to ED Quick Registration. Now we're going to search for the patient's name. This is the patient we're looking for. We verified the date of birth. Go ahead and click OK. By the way, these yellow boxes, these are hard stops. This information has to be entered before Cerner will let you save any of this info. So this is a shortness of breath, and they're coming in via ambulance. So now we are going to click Complete. An adult patient, we just want a face sheet and labels and an armband. Click OK. Now when that patient is registered, they'll automatically pop up down here in the waiting room, even though they're not coming from the waiting room. So this is something that the registration staff always does for us as well. But let's do it ourselves today. So we pre-arrived this patient up here into room 7. So we're going to move this patient to 7. And when you do that, it looks like there are 2 people here. So we need to combine our actual patient chart with our pre-arrival. To do that, we're going to go to the patient name, right-click, go to Attach Pre-Arrival. Now, over here, if you have multiple ambulances out at once, you'll have a list of them. You just want to click on it and make sure that you're verifying over here that this is the correct information. It's the correct patient. And this one is. So we're going to click Attach. And then we can close out of this. And you'll see that that will disappear. Now it is permanently in this patient's chart, that pre-arrival information. So now let's go over some of these icons. So over here, you'll have the acuity level of the patient listed. You have the patient name, patient age. This will be where you see which provider has signed up for the patient, much the same as the nurse column here, where you can see which nurse has signed up for the patient. Then over here, let's talk about these icons. If you notice the little caret up here, I'm going to click on it and show you what happens. It will expand your most recent set of vital signs on the patient. So this little heart icon here, the red outline means you have overdue vitals, and you can always hover over these icons if you can't remember what they mean. If we had one that had the heart all the way filled in with red, that means that there are critical vitals. So here, this icon, this is our task list, our nursing task list. So this is where we're going to find all of our orders. Let me scroll down here. So this column here, this is our IV fluids icon. This is our medications, our labs, EKG, radiology, and this is patient care items. So Foley insertion or visiting allowed. Then there's a column here too. This is for our consults. So you'll notice up here, this is grayed out in our medication column. So that means that there was a medication ordered and it has been completed. And again, you can hover over it and it will tell you that under the status. Then here you'll notice there's a green bar under this. Also, if you hover over, it will tell you that green bar means that those labs have been ordered and completed and resulted. Then on our EKG icon here, you'll see that it's outlined in red. That means that this EKG has not yet been done. Our radiology tab looks a little bit different. So I don't think I have one here that I can show you. So when the exam has been ordered and not completed in the radiology department yet, it will look the same as this right here with this empty bar that's highlighted in red if it's overdue. So then when the actual exam is complete, you'll get your green bar. And then when you get an official radiology read on that exam, this little paper icon will pop up. So we know on all of these, the exam has been completed and it's been read by the radiologist. So then also over here to the right, you get this column here that shows the patient's length of stay, and then this column here that shows the patient status. So this one that we just pre-arrived and registered from the ambulance, this one still needs a triage entered. Now once we document that triage, this will go away and it will say triage complete. Once the physician signs up for the patient and begins ordering a workup, then it will say something different here in the status column. I believe it says evaluation started, something to that effect. Let's look at, so if you chart, or if you click over here anywhere other than right on the patient's name, which is a link to their chart, it will pop up this window here. So this first window is a patient summary. So you get their acuity level, their allergies, their most recent visit list, any care plans that may have been entered while you were triaging the patient, their home meds, a picture of the triage with vitals. You'll get their medical history, their social history, their family history, procedural history. Then the next tab over, if you look up here, you can see that there are different options for these tabs. The next one over, if you click on that, that's our nursing task list. So this is where we do a lot of our charting from. You want to come here to look at your orders that the physician is putting in and review them, and then you can chart from here as well, which I will show you in another video. Then back up here to the top, you get the triage vitals and the most recent vitals. Then you can see the medications that have been ordered. You can see the labs that have been ordered and resulted here. You can see that there's an EKG ordered and not yet completed. Then here on this radiology tab, you can see the exams that have been ordered and their status. And also, once you get this little paper here that lets us know that there's an official radiology read on this exam, this will turn blue. So when this is blue, you know that you can click on that and it'll bring up your report direct from LaunchPoint window here. So then this would be your patient care items, and this would be your consult orders. We don't have any consults ordered on this patient right now. And if you'll notice, while I've been clicking through here, let's start over here with our meds. You have this list over on the right-hand side of favorites. This is something that you can enter your most commonly used orders into this, so that you can even order meds and labs, EKGs, radiology exams right from LaunchPoint. And I will show you how to do that. So we are going to go back here to our patient summary, click on orders, and then you have a favorites list up here at the top. You can go to organize favorites by your little star, and you're going to want to create a folder. So now you'll see up here we've done these LaunchPoint Labs favorites. That's what you want to label those. So you're going to label them LaunchPoint Labs or LaunchPoint Radiology. Make sure that you're labeling them to fit your tabs. Just going to put in the labs one again. And we're going to close that. Now, let's add something to our favorite. We're going to add a CMP, and our ER orders should always be stat. So we're going to look for that stat order. Sorry, we're going to right click on that, not left click, and click add to favorites. Now you're going to obviously not have 3 folders labeled the same thing. You're going to find the one that you just created, and you're going to add your CMP to your favorites folder. And then when you come back out here to this tab, that should show up in your, and I of course didn't add it to the correct LaunchPoint Labs, but it will show up here on your favorites. Okay. That's all we're going to look through in this video. We'll continue on with the patient chart in the next.